guys, it's Becca for one last video with the Hypervolt series. If you can do it on yourself, just some trouble areas. I'm here with Kayla. She's going to help us out. We're going to focus on the arm now. So you can do the hand a little bit. I would just be very careful. There's not a lot of muscle bellies. The main thing is probably like your thumb muscles over here. So I wouldn't mind, just be careful. You can hold it pretty light there. Watch around your wrist. You got your carpal tunnel here. You got all those nerves in here. So we're going to focus mainly on these muscle bellies here, because then we start getting into tendons while we get right around the wrist. So we'll start here. And I'm going to turn this on. So your flexors that bring your palm towards your forearm, they usually attach medially. So of course we're going to watch out for these, the bony protuberance over here. So the epicondyle of the humerus over here, and the lateral epicondyle. So, and then of course your elbow, so we won't hit that. So stay here right in the belly. You can head towards that medial side, which means inside, because that's where they're all going to be attaching. And then just be conscious if you get a little lower, you know, your radius and your ulna might stick out a little bit. Again, talk with your partner. Avoid those nerves, trouble area, nice little arm triangle, cubital space here. Like I said, if you want to hit the hand, go ahead. Just be very gentle, keep it in a controlled area. And then we're gonna, once we're done here, let's get the other side. So, and the extensors attached to the outside over here. So we're kind of going here. The radius is kind of twisted here. So just be conscious of that. You can feel it if it's really hard. If it's bothering your partner, just keep your hand there. Got a nice muscle right here on the inside though. Don't forget that one. Helps raise us when our hands in neutral here. Make sure you come up here and get the bicep. Make sure you don't hit the condyles here. Try and avoid that elbow space. So, sure. Come all the way up. The deltoid has 3 heads. Got one in the front, one on the side, and one on the back. So make sure we get all that. But I want you to take note. The clavicles are here. Got the head of the humerus here. Not a lot of muscle coverage here, so just make sure you talk. Feel the hard parts. Kind of block it off a little bit. Watch out for the spine of the scapula coming around the back. Stay in the front here, just so. Then I like to get the pec muscle. It comes right here, attaches over here to the arm. So we're going to come right in the front. Find out where the clavicle is and the sternum. Just a little palpation. Muscle bellies right here. Might be a little tender, a little more sensitive, pretty thin muscle. Come in the front again. I'll come around the back to get your rotator cuff. So rotates our arm, it's out, twisting it. So same thing we did when we had the back. Watch out for the spine of the scapula here. Try and feel where those bony parts are. Make sure you get these, because these can be pretty tight on most people. But that also means they're usually a little tender. So make sure you hold it a little lighter at first, at least. Make sure you get the tricep. We missed that a little bit coming up. Just gonna rest our arm in my hand. You can do it in any position. Make sure it's relaxed. Just check out where those bony parts are. Make sure you don't hit them. And then after a few minutes, nice and relaxed. If you see a lot of redness, start thinking of lightening up on the area. But it's just gonna make you a little sore, that's all.